Well, first of all, you should get checked, and usually prostate cancer is a slow-growing disease, and most of the time it's localized and very curable. You have to realize that you're going to the surgeon, and surgeons, they of course have their own inherent bias. They want to cut it out, but the radiation can be equally effective without having all the morbidity of surgery. I haven't met a patient who had surgery who was happy with the effects afterwards. I'm not saying that they weren't cured, but it's really something you really have to look at in terms of the side effects from the surgery. The other thing is that a lot more patients are coming, and I don't know if this is just because of the pandemic and late diagnoses, they're having more aggressive disease. And you have to realize that CyberKnife especially could be a very important part of this in terms of the treatment approach. And I don't think that surgery is necessarily the way to go with patients who have more aggressive disease like that. Radiation is just as effective.
Well, we used to think that CyberKnife was good for beginning and intermediate stage prostate cancer, but now we're learning that we can treat it beyond that, yes?
Yes, for sure. The fact is, if you have patients who have high risk, more advanced prostate cancer, the CyberKnife can be the mainstay of the treatment. I mean, often you have very high risk of lymph node involvement and/or distant metastases. But if your workup shows that there is nothing there, then really what you need is you need to blast away at that tumor where you do know the disease is. That's where you need to get the most dose, and the CyberKnife is the best way to do that.